Good morning, everybody. My name is Crystal Budd. I'm from Health Plans for Less, and I'm here to talk to you this morning about Medicare. Medicare is for those that are turning 65. I get some people that call me and they say, I'm turning 62. Can I get Medicare? No, you cannot. I'm not quite there yet. You can take your Social Security early, and I think that's where the confusion comes from, but you can't actually enroll in Medicare unless you're 65 or you have a qualifying disability. So people that are under 65 can get Medicare under certain circumstances. But that's a topic that can be discussed at a later date if needed. Medicare open enrollment starts October 15th and it goes through December the 7th. And enrolling on time is really important. When you age into Medicare and you turn 65, if you don't enroll on time, what that means is you have 3 months prior to your birth month, and then 3 months after. Because if you do not enroll into Medicare at that time, you'll be subject to a penalty. And that penalty, should you choose to sign up later, it will stay with you forever. Wow. It doesn't go away. So the government really does want you on board and getting health care. So it is important that you do sign up for your Medicare. There are several moving parts in Medicare. And it's like the beginning of the alphabet. There's Part A, Part B, Part C, Part D. Wow. And there's a lot of confusion about all those moving parts. So it's always wise to talk to somebody that's a professional to help you sort out all of the moving parts. Unless you are really detail oriented and you love to read and you're inquisitive and you are a good learner. It's hard to do all those things at 65 sometimes, to spend all that time to figure out all this stuff that they send you in the mail. So it's to your advantage if you can find a professional and work with someone that can help you sort through all those things. You don't have to waste a bunch of time. So and that's what I hear. It's like they send me this mail that's 3 feet tall by the time I'm done. And the reason they send you all that mail is because legally they're not allowed, and I'm not allowed to call you on the phone as a point of first contact. I'm not allowed to knock on your door. I'm not allowed to put a flyer on your door. So there's very strict regulation about how you get a client. So for example, if you send me a referral, I can't call them, they have to call me first. Once they initiate the contact saying, yes, I do want to find out more information, then that gives me the go-ahead that they want to work with me, or at least begin the line of communication. And so it's really there to protect the senior. Now, once you're a client of mine, then I have a relationship with you, and I can talk to you and call you because we have a relationship. There has been a lot of fraud in the last couple of years, especially with you see a lot of commercials on TV that says call in and check your benefits, you're missing benefits. Well, that's very misleading because most of the plans have all the benefits. They just may vary a little bit. And so it's a real problem, and people call in and maybe they're not checking the moving parts that are most important to the client. And they say, oh, I'm going to get a little bit more dental. Oh, great, I'll sign up for that. But they forgot to check their drugs. They forgot to check to make sure they just keep their doctor. They forget a lot of other things. But yeah, they're going to get that extra little dental coverage, which is really not that important compared to all those other things. So there have been some problems with advertising on TV and how I believe it's misleading people. And they feel like they're missing something. And they're not missing something. The plans, when I look at the pieces of that puzzle, I'm always asking, what are the doctors that are important to you that you want to keep? What are you taking as far as prescriptions? What is the frequency and the dosage? Do you have a favorite pharmacy you like to go to? So the goal is to make the transition easy, so that you'll be happy, so that you'll get everything out of it you need. And if I can't get that for you, then I'll tell you. Or I'll tell you, maybe the HMO model doesn't work for you because of your doctor choices. Maybe your doctors don't take the HMO model. Or maybe two of them don't. And you have to make a decision. What's most important for you? It makes no difference to me what plan you choose. All I want to do is my job is to make sure that you understand what you have, that you're going to be happy with what you have, and you're going to be able to have access to care when you need it. And so I really emphasize that in making sure that all of those things are covered. I'm going to show you a little video, a couple minutes long. It kind of I know some of us learn better through hearing, some of us learn better through vision or watching something, or it's even better when you can do both. So I'm going to put this little video on just to kind of reiterate some of the things I've already said, but to add a few more things as well, okay? So if I could have your attention for just a few minutes.
Just push the space bar.
Oh, this space bar.
Your Medicare plan is out there. Let's find it together.
Well, what exactly is Medicare?
Medicare is a federal program that provides health insurance to people ages 65 and older and those with certain disabilities.
How does it work?
Let's start with the basics. There are 4 different parts to Medicare, plus another optional component we'll talk about later. We'll begin with original Medicare, made up in parts A and B. Part A is your hospital insurance. This helps pay for inpatient stays, skilled nursing facilities, and hospice care. Part B is your medical insurance. This covers things like doctor visits, ambulance rides, lab tests, and medical equipment such as wheelchairs.
What about the other parts?
There's also Part D, an optional prescription drug plan that's separate from original Medicare. Each plan defines a list of covered drugs in the pharmacies where you can get them.
Wait, did you skip a letter?
We didn't forget about Part C, more commonly known as Medicare Advantage. Private insurers offer these plans as an alternative to original Medicare. They provide all necessary coverage in one convenient plan and with only one card to keep track of. Most Medicare Advantage plans also include prescription drug coverage and other added benefits like dental, vision, hearing, and even fitness memberships. But Medicare Advantage plans aren't the only way to get additional coverage. Medigap plans, also called Medicare supplements, help cover the copays and deductibles that original Medicare doesn't pay for. These plans are sold by private insurers, but the various plan types are standardized by the government. These supplemental plans can only be combined with original Medicare, meaning you can choose Medicare Advantage or Medicare supplements, but not both. So there you have it, the ABCs and D of Medicare. If you're ready to find a plan now, get started on MedicareFull.com. Want to talk with someone first?
Okay, so, that's not my phone number, by the way. You know where to catch me. Can we turn that off?
Don't worry.
Well, I don't want to leave that up here.
No, I was going to
Okay, all right. Okay, so that just I kind of told you a little bit about it. That just gave you another visual about the moving parts. There's 2 separate tracks, really, when you purchase Medicare. There's your Medicare supplement, and then there's Medicare Advantage. And then they interchange the language, Medicare supplement with Medigap. They're the same thing. Okay, a lot of people say, well, what's Medigap and Medicare supplement? Those 2 things are the same thing. When you purchase a Medicare supplement policy, your primary bills will run through Medicare, then you have a supplement, then they secondarily bill Medicare supplement company, which could be any of the private carriers, Blue Cross, Blue Shield, HealthNet, whomever, okay? So, and those carriers I represent. So, a supplement, why would someone want a supplement versus the Medicare Advantage? Somebody that feels strongly about having a PPO. Somebody that wants to be able to self-refer and not have to go through a primary care physician for a referral. Somebody that might have a doctor in Orange County and up in LA. Somebody that might want to say, I want to be able to take my plan with me when I move. You know, if I'm thinking about moving. Medicare supplements you can take anywhere in the United States. Whereas you can't with Medicare Advantage. So, those people, when they choose those plans, they have full control of their health care, how they use it, As long as the doctor takes Medicare, they can go to those doctors or hospitals. And they don't have to get permission. Okay, they can just use it. Now that costs money. So there's a premium to that. And that premium you have to buy then a separate drug plan. For a new person, pardon me, coming into Medicare, they have to weigh that cost out for those two purchase of the Part D, which is the drug plan, and the supplement. In addition, they're going to be paying their Part B premium to Medicare. So there's three things they're going to be paying for. And you look at that cost, on the average for a new person, it's around $400 a month. For really good coverage and your maximum exposure on, say, supplemental G plan is maybe, I think it went up to what? It was $202, I think it's $235 or something, I have to look it up. Just changed. So that's it, and they pick up 100% of everything, regardless of if you have cancer or heart attack, or as long as doctors take Medicare, they pick up 100%. So that's the supplemental option. And then there's the Medicare Advantage option, which is an HMO, typically. Not always. There are a few PPOs, and they're treated more like a traditional health plan. But the HMO is probably the most common in this area because we have a lot of doctors, we have a lot of good hospitals, we have a lot of good doctors in the networks. And if you are going to someone that you're already using and you really like them, and they're on the HMO, you're probably going to go with that because it doesn't cost you any additional money. There's a savings there for you. So the HMO model, for many of my clients, works really well in Orange County, LA County, San Diego County. Riverside depends. They have less doctors available out there. So Northern California, they have some areas where you can't even have an Advantage plan because they don't have doctor networks up there that are accessible. So we're very fortunate that we live in this area and we have lots of good choices. And so if I can take the information and I can say to you, well, that's another thing, you can try the HMO model for a year, and if you don't like it, guaranteed issue, you can migrate over to the PPO with no questions for that first year. And there's a couple carriers that will allow you to do that depending upon what's happening in the marketplace at different times, to go from one of their HMOs to a PPO. It just depends. So, and it depends on what's happening in the marketplace and if they're allowing that to happen at that particular time. So anyway, all I'm saying is if you want the HMO model and you want to save money and you want to try it, and like I said, we have a lot of clients that do it and they are very happy. But if you really want to have more control and you can afford to spend more money and you want to have the supplement, then that may be the choice for you. But everybody's different. Everybody has different needs. So like I said, I have my mom, she put her on an HMO. Partly she didn't have the money to spend the extra money because as you get older, the supplemental premiums get more expensive, right? Just like everything else. As you get older, it gets more expensive. And what happens many times is as people get older, they can afford maybe to buy the PPO today, but by the time they hit 75, they might think, I don't have the extra $500 a month. By then, it's gone up. So then we might migrate them over to the Advantage plan. Maybe they're not driving like they used to. They're like, I want my doctors to be in a 5-mile radius. I don't want to go up to LA. I'm not going to go these places that maybe I could go when I was 10 years younger. So circumstances change, needs change, and I really do try to check in with my people once a year, just make sure they're happy and that they're getting out of their plan what they need. So it's a critical time in life. That's when we need healthcare the most. This is when we age into Medicare. Do you have any questions?
So with the HMO model, is there zero out of pocket or is there still co-pays and prescriptions?
There are co-pays, but many of the co-pays are zero. Like, it depends again on the HMO. There's lots of options out there and they offer a few different things, the extra benefits, like some have hearing aids and some have more dental and some have a little more vision, or some have gym memberships, some have, so those things, most of them offer something in that area. Maybe one's better than another, but the co-pays typically are very, very low or nothing. Like in most of the HMO plans, you have zero co-pay for doctor visits, whether it's primary or specialist, zero for hospitalization, and that's the HMO. Medicare Advantage typically. Yeah.
So, So you reach the age of 65, you get on a good Medicare plan, you can pretty much, for the rest of your life, you're covered.
Yeah, well, you're never gonna be taken out of that plan. They can't kick you out. The only time you can get kicked out, if you will, is if you have a premium, you don't pay it. Or you don't pay your Part B premium to Medicare. Because your Part B premium, you must have Parts A and B. A and B are required. If you don't have those two things, then you can't sign up for any of these plans. And you get that through, you go through Social Security, they qualify you, make sure Part A is hospitalization, you are entitled to that for free, as long as you've paid into it 10 years and you're a United States citizen. And then Part B, you purchase, and there's a premium of $170 a month, and they will take it out of your Social Security, or they'll bill you on a quarterly basis. So that is the payment you will be making regardless. And then on top of that, you choose one of these Medicare Advantage plans for maybe a $0 additional premium, or you go into a supplemental plan and you might spend about, for a new person with the drug plan, it's probably averages around $200 a month, give or take. $10, $20, you know, depending upon your drugs and then you have drug co-pays. But all of the plans, there is nothing out there that's better. It's a great system. It really is. Not perfect, but it's really good.
I can hardly wait to be 65.
Well, when you think about what you're paying for health insurance today, it's a great value. Did you have a question?
So the Medicare supplemental, you said that can be taken from state to state?
Yeah, like I have clients that I've sold them here and now they're in a different state and they can keep it.
Okay.
Because it's the same, like if you buy, for example, the G plan is probably the most comprehensive supplemental plan right now. Used to be the F plan. A lot of my clients have the F plan, not my plan F. But you can't get that anymore. The government says we're not selling that anymore. It was cover 100% of everything, as long as they take Medicare, when it combined Medicare and the supplement. And I have a lot of clients that have that. It was the best plan available. Now we can't sell that, now we offer the G plan. See, everything changes. The G plan is still really good. It has a deductible though, you have to meet first before any first dollar benefits. It's like $235 or something like that now. So, but it's still a great thing. It's a really good plan. And you can take it anywhere. And you can get care anywhere. So that's unique to Medicare. You know, to be able to do that. In some cases, the premiums may be less here, and I've had a couple clients that moved to a couple different places, and I said, well, check and see if the premiums are less there, then you can enroll there in your state. That's totally fine, but I've had some that they keep it with them because maybe the premium here is a little better than another state. So they just have to decide. But the benefits, if they buy a G plan, it's going to be the same here as it'll be elsewhere, because it's mandated by the federal government what the requirements are for that plan. So, anyway, any other questions?
You said they take the money out of your Social Security. What if you're not collecting Social Security?
That's a good question. I get that a lot. So if you're delaying your Social Security, they will send you a bill.
Oh, man.
You don't have to, it's not that you don't get to pay it.
You're really good at it.
They send you a bill, and it's usually, if it's not billed monthly, it's usually quarterly.
Yeah.
So it's, you know, because of the paper jam, they send it to you quarterly. But if you do take Social Security, they will take it out automatically. There's no option on that one. They will take it
So that's
out.
automatic?
It's automatic if you sign up for your part. If you have Social Security and you sign up for Medicare, they will automatically take out your Part B. You don't have to say so. If you don't get it, of course, then they have to bill you because there's nothing to take it from. Does that make sense?
Yeah.
Okay, so as you can see, Medicare is an exciting business. There's lots of changes going on all the time. And I love working with seniors, and I really do my best to help, again, make it easy for them, make sure they get what they need. They can sleep at night and feel like, okay, I'm good in this area. At least one area I can put to rest, okay? So that's what I really try and do. So thank you for your time and the opportunity to serve this group. Thank you so much.